Hi, my name is Angelo, and I'll be presenting on cocaine addiction today. So to start off with the anatomy of cocaine addiction, cocaine is an abused drug because it's used as a stimulant to elevate your energy and mood. Like any other drug, cocaine will concentrate on the reward pathway, basically meaning that people will either use or abuse this drug to stimulate the mood and reach that elevated energy. Because it is an active part of the brain that controls the voluntary movements, users may appear to be fidgety or they can't seem to stay still. Addictive drugs can be found to alter the neurogenesis in adults, therefore meaning that the growth and development of nervous tissue is therefore altered or changed because of this abuse. More touching on the anatomy of the subject, you can more or less see the exposure of using cocaine, ranging from the initial exposure of usage to chronic exposure. Initial exposure is more so leaning towards about 5 days of it lasting, and it results in a significant alteration in functional activity. Um, the pattern changes are limbic in nature, and they're confined to the ventromedial and the prefrontal cortex, or the ventromedial prefrontal cortex and the ventral striatum. And chronic exposure is just any exposure or use after 100 days or anything following that. Continuing exposure aids in widespread expansion of alterations. The exposure will begin to start to affect the hippocampus, the temporal and parietal cortex, and even inflict more damage on top of the initial exposure aspect as well. Touching on the physiology of the subject, like I have mentioned before, cocaine is an abused drug due to its qualities of just elevating the mood and the energy. These effects are produced through the activation of a mesolimbic reward pathway in the brain. Addictive drugs will promote the activity of the dopaminergic neurons that are originated in the midbrain and thereafter will terminate. So you can see in this diagram on the side how there are dopamine receptors here located here, as well as dopamine neurotransmitters, these little yellow balls that are attached to the receptors. And therefore, they're trying to go through here through the dopamine transporter. And you see that cocaine will block these transporters and therefore just block the reuptake of dopamine through these transmitters. The cocaine will cross the blood-brain barrier and block the reuptake of the dopamine. It also serves as a triple reuptake inhibitor, blocking the transporters for norepinephrine and serotonin. Cocaine will produce a sort of sense of euphoria, increasing your energy, self-confidence, and mental alertness. When using larger doses of this drug, it may cause a more psychological effect, such as paranoia, erotic behavior, panic, and can even get it to as worse as getting tremors, vertigo, and amphetamine psychosis. And this repeated use can cause the sensation of feeling euphoric and replace it with a lot of insomnia, meaning that you're all up all hours of the night, you just can't really sleep, therefore touching base on the paranoia and the panic. Heavy users can also develop psychological dependence, which therefore would aid in the promotion of depression in a user. And physical symptoms can also include agitation, tachycardia, elevated heart rate, and fluctuating blood pressure as well. A way of diagnosis and treatment when it comes to cocaine, there are different methods available. With diagnosis, it takes into account the factors of administration and how much you administer into your body and which route this admission is going through as well. Um, and what is also taken into consideration is the amount of toxicity, the effects of detoxification, and psychiatric comorbidity. Treatment, there are many rounds of treatment that you may be able to get available for you to use. There are standard treatments such as a 12-step AA recovery model, but it even goes to as far as experimental types of treatment such as cognitive and behavioral approaches, psychotherapy, and psychopharmacotherapy as well. As far as artificial intelligence, the most common type of IA and drug treatment has to do with matching patients to their optimal drug or combination of drugs, and therefore just trying to predict the drug to drug interactions and optimizing treatment protocols. To optimize the dosage scheduling for administration, there are mathematical models that are being used to interpret the pharmacokinetic and the pharmacodynamic data. And some demographics to look at, since the late 60s, there has been an increase in popularity of cocaine usage. And also leading into the late 70s, even the early 80s, the cocaine epidemic. The epidemic is still relevant today as far as being, very widespread and popular. About approximately 19% of Americans between 18 to 25 have admitted to having used cocaine, and 1% admitting to using it more than once a week. A sort of demographic of people who may use it more tends to be young single people are the most frequent users, typically males outnumbering the females in a ratio of a 2-to-1 scale. And then in this diagram, you can see the mean ages of death in a year of different drugs, and you can see cocaine right here coming in at about 40 million a year. And these are my references. And